Hello, and welcome to Chagpar MD. I'm Dr. Anise Chagpar. Have you ever wondered what are the numbers you need to know that really will impact your longevity, your risk of heart disease and cancer and diabetes? Well, in this video, we're going to talk about the 5 numbers you need to know and how you can improve those numbers so that you can live a healthier and better life. Want to know what they are and how you can improve them? Well, let's take a look. So what are the 5 numbers that you need to know for your overall health? And more importantly, what can you do to improve those numbers? Have you ever gone to the doctor and tried to get a report card? Well, here are the 5 numbers I think are most important for your overall health. First, BMI, your body mass index. Second, your waist circumference. Third, blood pressure. Fourth, cholesterol. And fifth, your blood sugar. Now, I will tell you a little bit more about why I think these numbers are so important. But more importantly, I'm going to give you tips and tricks to improve all of these metrics so that you can live a healthier and better life. So first, your BMI. Everyone should have a pretty good idea of what their BMI is. And you can look that up on a chart like this or on an online calculator. And I will leave you a link for a calculator in the description box below. But if you look at this chart, it's pretty easy to figure out. You find your height on the left, find your weight across the top, and where those two meet, that's your BMI. You want to be in this green zone. That's a healthy BMI, somewhere between 18 and 24. You don't want to be underweight, but you certainly don't want to be overweight or obese. We've talked in this series of videos about the effects of being overweight or being obese. It increases your risk of heart disease, of stroke, of cancer, of diabetes, and so many other potential health problems. And remember, if you even take just heart disease and cancer and put those two together, that is almost 50% of all deaths of Americans. So simply by reducing your body mass index, you can potentially improve your longevity by reducing your risk of both of those conditions. So it matters because it increases your risk of all of these things, and diabetes also increases your risk of heart disease and stroke. Now, if you're thinking, yeah, my doctor always tells me about heart disease and cancer and stroke, but that's never going to happen to me. Well, that may be okay, but think about the things that you really don't want, all of which can be side effects of diabetes. So diabetes itself can lead to blindness, deafness, kidney failure, gangrene, nerve damage. It ranks pretty high up there on the diseases I never want to get. And by reducing your BMI, you reduce your risk of diabetes as well. Now remember, BMI is only made up of 2 factors, your height and your weight. Well, you can't make yourself any taller. So this really goes into losing weight and how to do that. I'll link below to several videos that we've made on things that you can do to help you to lose weight, whether it's figuring out your total daily energy expenditure and figuring out how you can eat fewer calories to fit within that, whether it's low carb or low fat, whether it's keto or IIFYM. We've done videos on intermittent fasting, which can also help, and I'll leave you all of those links below. Now, it's not just about your BMI. And we've talked in other videos about this concept called skinny fat, which is your BMI can be totally within the normal range. But if your waist circumference is more than 35 inches if you're a woman or 40 inches if you're a man, that really might be a signal to you of visceral obesity, carrying that weight around your midsection, kind of having more of an apple shape than a pear shape. You could also look at your waist to hip ratio, which ideally should be less than 0.8. And so, what's the impact of visceral obesity? Well, again, all of those things that we've talked about before. If we think about visceral fat, it really increases a number of cytokines, whether IL-6 or TNF alpha, interleukin 1 beta, and others. And that really leads to this whole cascade of diseases and conditions that you don't want to get, from insulin resistance to diabetes, cancer, heart disease, stroke, Alzheimer's, and so on. And we know that by reducing your visceral fat, you can potentially reverse some of these conditions. So you want to reduce weight and get yourself into the ideal body weight area. But how do you do that? Well, it all boils down to calories in versus calories out. And you really need to figure out a way to be consistent and vigilant about measuring these calories and sticking to a healthy regimen that allows you to get fewer calories in than calories out if you need to lose weight. Now, can you lose weight on the Twinkie diet if you still eat fewer calories than you put out? The answer is yes, but that doesn't do any good to your overall health. So remember, you want to focus on good nutrition, getting in the macro and micronutrients you need in order to be healthy. And finally, I can't emphasize enough the value of exercise. Not only does this really promote your calories out equation, but it also really helps in terms of physical conditioning, making sure that your heart is pumping the way it should, that your lungs are breathing in and out the way that they should, and that you're overall staying healthy mentally and physically. We have videos coming up on the value of exercise and what kind of exercise is best for you. But here's the short synopsis. Any kind of exercise that you enjoy is the right kind of exercise for you. Make sure that it's something that you can do that will be consistent. Ideally, you want to get at least 150 minutes of moderate to vigorous activity per week. Now, if that's a 150-minute hike on the weekend, fine. Or if it's a 5-minute walk before breakfast, at lunch, after dinner, and then maybe a 15-minute workout before you go to bed, that adds up too. So remember, however you can get your diet and exercise in line with your weight goals is really going to help. Now, the next number to pay attention to is your blood pressure. It should be less than 120/80, and more studies are figuring out that really lowering your systolic blood pressure, that's the top number, even lower than 120, may actually give you some health benefits. Hypertension or high blood pressure increases your risk of heart disease and stroke. And again, there are a number of things that you can do that can help with this. So, diet, exercise, limiting your salt intake, limiting alcohol, considering medications if you need to. What about your cholesterol? Well, when we talk about cholesterol, we talk about a few different categories of cholesterol. Your total cholesterol, which is also broken down into your HDL cholesterol, what we call the good cholesterol, and the LDL cholesterol, or the bad cholesterol. And so you really want to limit your LDL cholesterol and bring up your HDL cholesterol. Why? Well, because your bad cholesterol really forms these plaques on the inside of your blood vessels. So think about somebody depositing some goo in terms on your blood vessels. As that builds up, the lumen or the space that the blood cells have to travel in those blood vessels gets smaller and smaller. And ultimately, when that gets occluded and the blood can no longer flow, that causes real problems. Because when that happens in your heart, that's called a heart attack. And when that happens in your brain, that's called a stroke. And when that happens in your lungs, that's called a pulmonary embolus. And all three of those things can be fatal. So the HDL cholesterol helps you to regulate that LDL storage, and it promotes excretion of bad cholesterol. So you want to increase your HDL cholesterol and reduce your bad cholesterol. And overall, keep your cholesterol as low as you can. Great. So how do you do that? Well, it comes down to diet and exercise, as so many things do. In terms of diet, you want to avoid foods that are high in saturated fats, avoid high cholesterol foods, and incorporate foods that can lower your cholesterol. More on that later. Also, a number of studies have found that exercise actually helps in terms of lowering your cholesterol. And if diet and exercise don't work, well, then you can try medications. But remember, trying to build in good, healthy habits in terms of your diet and exercise can oftentimes get you off those medications and build an even healthier lifestyle. So, what foods affect cholesterol? Well, you have high cholesterol foods, egg yolks, red meat, whole milk, cheese. These all are higher in cholesterol. Foods that can help you to lower your cholesterol, things like oatmeal, nuts, vegetable oils, fatty fish. So try to build in some of these foods to help you to regulate your cholesterol and try to keep your fat level as low as you can. You want to limit your cholesterol to less than 200 milligrams per day. So if you're wondering why I talk about age and BMI and cholesterol and blood pressure so much, well, it's because it really has an impact in terms of your overall health. Have you ever wondered what your heart age is? Just kind of like those calculators that say, how old do I look? Well, this is a calculator that can really predict how old your heart is, which may not be the same as your chronological age. And it can predict your 10-year risk of having a heart attack or stroke. Notice that things like family history aren't in the equation. And this is a validated heart risk score that was developed by people who were part of the Framingham Heart Study. I've left you a link here, and I'll put one in the description box below. It's a great calculator, and I hope that you check it out. The next metric is your blood sugar. You want to make sure that you keep your blood sugar within a normal range, which means that your fasting blood glucose level should be less than 100 milligrams per deciliter, and your hemoglobin A1C should be less than 5.7%. Now, if you do a simple random blood glucose, that should be less than 180 milligrams per deciliter. Why is blood sugar important? Well, because it leads to diabetes and prediabetes. So what can you do? As with so many things, it comes down to diet. Diet, exercise, and a few more things that we'll get to. But in terms of diet, it's been shown that a low carbohydrate, high protein diet can be particularly helpful. Now, when you're thinking about carbohydrates, you want to really focus on complex carbohydrates rather than simple carbohydrates. So fruits and vegetables, whole grains, nuts, seeds, beans, rather than simple sugars. You also want to consider low glycemic index foods. These are foods that are less likely to be immediately converted into sugar in your bloodstream. And increase your dietary fiber, especially soluble fiber. Want to know more about glycemic index and fiber? We have videos on those coming up. So just hit subscribe and the notify button so that you don't miss those episodes. Again, maintain a healthy weight. There have been studies that have demonstrated that reducing your weight by only 7% reduces your chances of diabetes by 58%. So in other words, a small reduction in your weight can result in a massive reduction in diabetes risk. And portion control. We talked about portion control in an earlier video when we were talking about reducing weight, but that really does play a role for diabetes as well. Now, there are other things that you can do. Not surprisingly, exercise is at the top of this list, but other things also play a role: hydration, reducing stress, and sleep. And yes, we have more videos coming up on all of these. So hit subscribe and the notify button, and you'll learn more about all of these things in upcoming videos. So what is the bottom line? The 5 numbers you need to know: your BMI, your waist circumference, your cholesterol, your blood pressure, and your blood sugar levels. Ultimately, these 5 characteristics play a key role in longevity and health in terms of cardiovascular health with heart disease and stroke, cancer, Alzheimer's, and diabetes. We want you to stay as healthy as you possibly can, and I hope this video has been helpful in terms of giving you some tips and tricks that will help you to get your numbers to where you want them to be. Again, if this has been helpful to you, please like and share it with a friend. Subscribe. Make sure that you tell a friend to subscribe as well, and hit the notify button. We have lots of great information coming your way, and I don't want you to miss anything. Remember, subscribing doesn't cost you anything, but ignoring your health can really be a big cost. Until next time, I'm Dr. Anise Chagpart, wishing you all a healthy and safe week.